Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm your host, Logan Plaster from Startup Health, and I'm here today with Gerald Wilmink, Chief Business Officer at CarePredict. Jerry, thanks for joining me for the morning.
Thank you for the opportunity, Logan. It's going to be fun.
So, Jerry, I was just watching the last interview that we did with you, and it was at the Startup Health Festival in San Francisco a few months ago. And someone asked you, "What is 2020 going to look like?" And you said your words, "It's going to be a wild year."
So it's going to be a wild year. We're very excited to get the product in seniors' homes now.
I think it's going to become industry standard worldwide.
I can predict the future, apparently.
Yes, with care. So you predicted accurately it was going to be a wild year. At the time, you were saying that because you were scaling up operations with CarePredict, you were really gonna go big with distribution. So let's sort of back up. Tell me where you're at with the CarePredict platform. I know this is let's see if I understand. This is a wearable for seniors. Helps not just give vitals. It doesn't give vitals in the moment, but it predicts problems that are going to happen in the future by understanding their movements, understanding their patterns, things like that. So the prediction element of care.
You got it.
Is that correct?
Yeah, you got it. So I'll dial back to BC before coronavirus. So in January of 2020, we had launched our product actually for use in the home setting. So this is our wearable.
Give me a nice close up. All right, cool.
Okay, cool.
All right, sweet.
Still haven't learned all the tricks of the trade here. But this wearable device is designed specifically for seniors. And we had installed this product and system in independent living, assisted living, and memory care communities across the United States and Japan. And what it does is it measures the activities and behaviors of a senior and can pick up subtle changes in those behaviors, which are essentially surrogate markers for when a senior is suffering a health decline.
Sure.
So for instance, if I'm suffering, say, the early signs of depression, I may not spend as much time outside in direct sunlight. I may eat more Ben & Jerry's ice cream or eat less. What we find with seniors, they skip meals, they eat less. I may participate in less and even avoid social contact and maybe take less care of myself. Less care of myself. So all of these things we autonomously measure with our wearable device 24/7. And then when it goes outside of that individual's baseline, it will tell the staff, you may want to look into this.
Okay.
This individual is, one or two standard deviations outside of their baseline for physical activity or sleeping durations. And then we predict when they're at risk for a urinary tract infection or depression. So the system has been in use in senior living facilities for several years. And this is actually version 3 now of the wearable and of the entire system.
So my understanding is that you are really on the cusp of kind of a consumer breakout. You won an award at CES this year. Is that right?
Exactly. So we commercialized this product and it's been in use in senior living communities. And then we had all this inbound demand from home care agencies and families of senior loved ones that live in their own home. They're aging in place. And they said, why can't you make a version of this product with the beacons and the software package that is readily available to seniors aging in place? So we did. So we made, using our same deep learning platform, kind of all the hard work had been done, and then made a more user-friendly kind of interface and Android app and iOS app that the family could access and be a member of that care circle and actually see what was going on with mom at a distance.
Gotcha.
That they were doing okay. So we launched that in January. One of this, a recipient of the CES Innovation Award, and had begun closing lots of deals with major, leading home care agencies across the United States, including one in Right at Home in Detroit, a Right at Home in New York and Sarasota, and several other home care agencies. So we'd begun to kind of ramp up that effort. And then fast forward into February and March, pandemic hit, and everyone was trying to figure out what to do exactly next. And so in senior living, what we found is, rightfully so, they locked down and imposed some very strict measures in senior living, because given how vulnerable seniors are to the SARS-CoV-2 virus and just how deadly this virus can be, they started locking down the seniors, basically stopping all kind of social activities within the communities, prohibiting visitors from visiting with their family members inside of the community. So this led to really kind of negative effects for residents in nursing homes and also in these facilities. So we found that they really needed a tool to, one, test more frequently, which, the new PCR tests that have become more rapid are critically important. But also, once they identify a case, to trace all of those contacts and quickly isolate and quarantine them as fast as possible. And that's really what so we put together a 3-week sprint and developed Pinpoint, which is essentially instantaneous contact tracing for nursing homes and senior living facilities.
Is Pinpoint a software using the same hardware that you've already developed?
Exactly. So we leveraged our real-time location system in our wearable device, which all the senior residents and staff members wear in the community. So we could, if an individual is test positive for SARS-CoV-2 in the community, they then can trace and run a quick iteration on our software to identify and locate all of those individuals and who is at high risk and maybe at lower risk for being infected. And this is incredibly important because many people, when they're infected with the coronavirus, actually go through their incubation period. And once they actually come out of that latent period, they start to be very infectious before they're showing symptoms.
Gotcha.
So the challenge then in the senior living community, which is congregate housing, so they're in constant, the staff and seniors are constantly in contact with each other. You need to know who has been exposed to a particular person, so then you can focus a lot of efforts on those high risk contacts immediately, because they may not for several days.
Yeah.
You want to make sure you isolate or quarantine those people immediately. Otherwise you get a rapid community spread, which we've seen.
Yeah.
A third of all the deaths in the United States, maybe higher, have actually been to residents in nursing homes and senior living.
Take me back to the decision to do this sprint, to really develop an entire product in a month or less in the height of this situation where your own staff, I'm sure, is having to work remotely. You're having to rethink some of your systems. Maybe you were already virtual, but I'm sure this threw a monkey wrench in some of your own work. And to say, okay, well, what was the catalyst to say it's worth pushing in on this?
Honestly, our leaders, our CEO, Satish Mova, and our COO, Greg Zobel, and our CTO, Dave Marcilla, they've done several startups before. Mm-hmm. And I attribute a lot of it to their hard work and the team's work. But at that moment, the idea to leverage our kind of leading real-time location system, which was already in place with our customers. Yeah. The wearables, which were already in place, which could really kind of set the stage for really accurate contact tracing. We said, you know what, our customers could really benefit from this. And it would take us a few weeks to do this well, but I think we got to put the bet in and do it. And so honestly, it's their insight. I may be a little bit more nervous about pursuing an entire new product like this, mm-hmm. but really the hardware was in place, and it was actually an opportunity for us to really deliver for our customers in a way that they really needed. So I'm glad that they had more of the foresight to push hard on this and deliver quickly. We're developing now version 2 of Pinpoint's software. But the software came out and our customers have been using it immediately.
How many people are currently using it? How many systems, or just how big of a test?
Yeah. So there's thousands of users, and over 20 communities are actively or even proactively using it, because you can run our Pinpoint software and identify, for instance, contaminated locations.
Okay.
So if someone's infected, you can look at for those direct contacts that they made over that 14-day period. You can look at, kind of 2 orders out. So who they came in contact with, and then the individual that maybe they came in contact with during that kind of day 3 or to day 5 of their after infection. So they're infectious, but not showing symptoms, so looking for that cohort. And then the third piece is the contamination. So the infected person may have spent 6 hours playing chess in the social room in one of their social areas. So now you can actually replay those locations and say, okay, let's go in there and decontaminate that room because, that particular infected person was in there for an extended period. So the materials and surfaces may lead to foam white transmission. So we can go in there and clean the surfaces. So version 1 had all of those pieces and those tools and that tool set already there. And now we've built a whole new kind of really more egocentric interface that has the transmission networks where there's actually nodes. So the UI is much improved and it's automated, makes it a lot easier for the customer to use the product. So it's
got it.
Very exciting.
So V1, you rolling it out with thousands of people. Obviously, the potential impact for something like a automatic contact tracing device is in the millions. So the big question is what's next? How do you expand it? Do you really blow it out, or do you sort of stick to your niche market and keep growing with the senior living facilities?
Yeah, no, that's a great point. So in the industry right now, the nursing homes and long-term care communities or facilities are still in pretty much a lockdown. And as we move forward in the next couple months, they're relaxing these restrictions because the seniors need to, the senior residents, they need to see their family members. It's not healthy to be, in a room and not getting physical exercise and social, their social health is being impacted. So now a tool like ours allows them to safely kind of relax some of those restrictions and yet ensure that you don't get a rapid outbreak again. Because, in the next couple months, unfortunately, we're kind of seeing this in the states that are reopening at a more macroscopic level, is that if we don't take the precautions and wear masks and retain and maintain social distancing, we're going to see an uptick in cases, which then can lead to, another wave. And it may come now instead of in the fall or in the winter. So we need to take those actions. But the tools like ours specifically were built for senior living, long-term care facilities. However, I will say there is extreme and very strong interest from leading, hotels, cruise lines,
interesting,
even factories, because it's a very lightweight installation. It's a device and beacons, and it gives us, it's really ideal for indoor, particular congregate housing settings, like a cruise ship or a hotel, where they have the social contract in place where, for instance, you may be wearing a wearable device already. So I took my family to Disney World, for instance. We put on our magic band.
That's right. And
opened my hotel, used it as my digital key for the hotel, used it to purchase things at Epcot Center, and even bought, and used the tickets when we went to the Magic Kingdom, swipe my bracelet. So this fits, and that's kind of what we've done in senior living, is this wearable device doesn't just measure activities and behaviors to make predictions. It also has heart rate sensing, pulse oximetry for blood oxygenation levels, which is becoming more important now. Temperature humidity monitoring, UV sensing, ambient light sensing. It has all that on board.
That's really,
yeah.
I think that point about locations, communities where there's already a social contract is really interesting, because obviously there are privacy issues with tracking devices, and yet what you're saying is that we already have low-hanging fruit. We have places where we're already agreeing to a contract.
Yeah, exactly.
A hotel, yeah.
Yeah.
So what's the install like for, let's say I'm a factory and I want to use CarePredict? What's that like?
Yeah, see, the factory setting may be a little interesting, but I'll say a cruise line, for instance.
Mm-hmm.
So what we would do is we would get the floor plans for that entire cruise ship. We'd identify and determine how many wearables they would need, both for the staff and for the the customers on the actual cruise. And the wearable device, each customer and each staff member, and this would include everybody, because you want to make sure everyone has one of the devices to allow for really detailed tracing. We then place the wireless beacons in each discrete room. And that allows us to get really granular data, where you can get down to the room level. Because this is where our technology really shines is, so if Logan, you and I are in the same room with our devices on, the beacon would confirm that in fact we are in that small confined area, that the exact duration that we were in contact there in that room. The advantage of our system compared to, say, a smartphone-based Bluetooth app is the Bluetooth chirping from one smartphone to another is really useful for general random incidental contacts out in the world. Now, it starts to it will struggle in environments where there are actually closed thin walls between individuals.
Okay.
So for instance, I'm in my office now. My kids have one of these on and I have one on. My daughter's standing outside that door. It may say that we're in close contact with each other, but actually that's just because the Bluetooth actually bleeds through the door. It has high transmission through the door.
Got it.
So,
and that muddies up your data.
Yep. And so with ours, it's pretty accurate because it's based on that inside that room.
That's because you've done the more strenuous upfront work, the setup. You've actually looked at the floor plan. You've put the beacons in each room. So
exactly.
In other words, to do this at that granular level requires some extra legwork. It's not just this automated, just an app you throw on and then it's all done.
Yeah, exactly. Yeah, there is some additional, the beacons allow for line of sight and more accurate data collection. Yeah, and that does require us to put that infrastructure in, but it is worth it because, you'll have much lower missed contacts and error and false positives.
Well, a lot of times when I do these interviews, innovations seem so, not obvious, but like so clear and so beneficial that it's like, why haven't we done this yet? Why didn't we do this 5 years ago? What are some of the big barriers to rolling out a big system like this, whether with seniors or more broadly? Is it more about security? Is it the hardware? Is it just scale? Is it just getting it out there? What are the big barriers?
Yeah, this is my second hardware startup. So I previously was the founder CEO of a wearable tech company for seniors, where we made wearable devices for seniors.
Okay.
And then I came on board at CarePredict, despite the fact I knew very well, hardware is hard. Developing connected devices, there's a lot of design considerations that need to go into, because you need the user to be compliant and wear the device, right? Manufacturing at scale, high volumes of devices is difficult. And then also creating software, really advanced software to collect, to take that data and make predictions. this is very, very difficult. So the team and the resources needed to deliver these types of products, it's incredible. I mean, the type of expertise you need. I think the hardest part is all of it, because, and knowing who to say yes to and who to say no to. I mean, we have several opportunities that come across, the table that may seem like a good opportunity to move on now, but actually, our customer base, for instance, in nursing homes or in long-term care facilities, needs this now. And then we have the challenge of, but they're in lockdown. So how do we get in there in a safe manner, install this system, even though they're not allowing outside visitors to get in there? So there's a lot of twos where, so we have tons of orders that we could not install because of these lockdowns we're waiting on. So we're ready to do a really significant number of installs now in the next coming months. But I'd say the challenges are, there's a lot of challenges. And then on the financing side, we're going through some major financing round now. And, the groups that we initially were talking to are now very, very interested in what we're doing because they've seen, I think a lot of investors looking at connected devices and wearables are like, oh, it's a really tough business. And we're concerned that what if the seniors don't wear the device in the community, then you don't have the data. Well, what we've shown in our outcomes papers and now some more recent work is we're getting the compliance now. 95% of the staff and residents are wearing the product. Yeah. So now you're getting that data. They have a communication medium now. They communicate back and forth from the wearable device, using it as for concierge services, or if they fall, they can call for help immediately and we know exactly where they are. It's incredibly useful to the user. But I think having that knowledge of the senior resident and what works for them, you have to make specialized products specifically for them. You can't just give them, an off-the-shelf smartwatch and, with a tiny screen on it that they can't see and say, use this. Yeah. A lot of design considerations that go into making products for this particular market. But all of it's hard.
It must have been, it must be emotionally difficult for you to not be able to do these rollouts during the pandemic, knowing that you could be helping bring some independence and some mobility to these seniors.
Yes. Yep. All of our customers, we made it free. It was free to all of our customers, the Pinpoint software.
Okay.
So they had all the products working. And then we added this whole new layer, this suite of product called Pinpoint contact tracing. So they had it available to them free. And then now as we move into this.
Sorry, when was that rolled out? And have you gotten any feedback about it?
It's been used quite frequently. And they use it proactively too. If they're suspicious of a case, they'll actually run it to look at other individuals that maybe they need to watch in the event that test comes up positive, because there's some delays with PCR testing.
Sure.
And so they're using it in a lot of sophisticated ways. And we actually just wrote a viewpoint paper to kind of detail how this works and how and the success of using our product. So maybe for a follow-up show, I can go on that and I'll send you that paper as well.
That's good. That's good stuff. Well, Jerry, that's all the time that we have. I really appreciate the work that you are doing. You have made really this a life work. And as you've described it, it hasn't been easy to focus on hardware. I hope for your business and your work, I hope that the hoops that you're jumping through also create unique opportunities, because where there's challenge, you sort of weed out some of the people who don't have it. Yeah. The people who can't hang. So so I know there's opportunity in that challenge and in those struggles. But I thank you for how much you're working in this area.
Thank you so much, Logan. Really enjoyed it.
All right. Take care, Jerry.